Welcome, everyone. I want to recognize a very important aspect that we have not practiced, and I've recently had an experience. And all experiences are not necessarily good in our life. And when we realize that there are certain challenges that come our life, we learn from the challenges. And it happened recently to me, and I'm sharing that with you today. Interestingly, as you know, we've been practicing the area of, for example, we've been practicing the eyes, particularly the movements of the eyes, and that part of it. However, the thing to be done is we leave all the vision check to the eye doctors or optometrists. We say, oh, either you see things or you don't see things. We just leave it to them, as was my mistake. I'm a doctor. My wife is an eye doctor. It was my mistake. I want to declare that. My big mistake. I had cataract surgeries 5 years ago. And the reason why I had cataract surgery is because I was seeing a very bright light coming in. And the bright light of the neon headlights that come in, I was not able to see very clearly. And I was dazzled in all. But that was fine. After the cataract surgery, I was fine. Recently, I had some situations where I was not able to recognize certain signs. For example, a stop sign is coming in a red light. As I'm approaching driving, I had some situations coming in. I was not able to see some movements on the side. Somebody, pedestrian walking, or maybe line. It was a little hazy. The point I'm driving at is that this was something recent and I got my edge. This point I realized, and I'm going to cut short the story so that we can practice this. And I realized that I have something called low tension glaucoma, LTG. Tension glaucoma means the high pressure inside the eye, and the low means the pressure is normal. But two interesting things I learned about low tension glaucoma. Very fascinating to me, and I'll be open to getting any kind of feedback on this. One, the reason is not known. They even think that low tension glaucoma is a misnomer. Second, there is no treatment. There's no known treatment. It's a progressive situation. And so what has happened in my situation is I have diminished peripheral vision on one eye, much more than the other. And that happens to be a situation. So let's do the testing on this. The testing has to be done now. This is the key point of what I learned. We can see very well. I can see very well 20/20 all around. I have no problem with it until I close one eye. So let's do this. Let's do our own checks. Eye doctors can do whatever they want. We need to learn how, like what we keep open the two nostrils, we have two eyes. So let's check the eye, keep the book in front of you, close one eye and see how clearly you can read it. Keep a distance that is necessary for you to read. Read it. Then close the other eye. Close the other eye. And compare. See what it is. If you have glasses, you can check the glasses. This is a simple test for the eye test. I wish I had done that, and I wish the doctors would have done a proper field of vision test. They didn't do it. Even during the cataract surgery, after cataract surgery, they're not doing it. So whatever the reason, I missed it, and I acknowledge that. So now, second test I want to see. So check, make sure you check this, and if there's a little difference between the two, you got to get it checked out. You make sure that you have enough, and then also if even the pressure is normal, first thing that can happen is the field of vision. So now you take your book, keep it in front, and go on the side here. Keep staring in the front and keep coming, moving the book toward the front here till you start seeing the outline of the book. You'll start seeing the color in that book, you'll start seeing something. So this is the field that you're testing yourself. Test way out there, go all the way out and come in. Do the other side, close the other eye and come in. Slowly, take your time. See how much you can see. And typically 135 degrees, 140 degrees is what they say. 145 is approximate. I think Dr. Jubinder will be able to tell us more, but it's about 135. If you open up your arms like this on the side, you can bring the finger in. You don't have to have the book. Thumb up like this, and the thumb can come in. Watch the thumb coming in. See what you can see and how much is the vision you have. If you have a smaller than that, you have a problem. I have a book with colors on this. You can see colors also, because colors and rods are the ones that, these are on the outside, and they're the ones who recognize the color a little bit. So you can do those kinds of testing. The only reason why I'm pointing this out is because of my experience. I've had the drops, and they're trying to do something with it. But this is something, revelation, and we have two of each, two nostrils, we have two eyes. And each eye have to be tested individually, because with the two eyes open, I'm wonderful. I'm completely normal. Well, that's not very good, because you lose something, you lose something. So thank you for that. And we'll talk more about that in the next section.